then the other two might make more sense. So
Mhm.
I really think that what you're highlighting of allowing us, like using the tools to meet patients where they're at, is huge.
Mhm. Mhm.
Yeah.
And to speak to that point too, I think you bring up a good point indirectly in the sense that exercise and any intervention for that isn't necessarily appropriate across the board for any illness, but also any stage of illness too. So again, to keep it simple and speaking about depression, sometimes we separate it into mild, moderate, or severe. And as you gave in the example before, someone who's like sitting on the couch, they don't have the energy to get up and eat or even do self care things, it would probably be inappropriate to even suggest, like, hey, you should just get up and exercise, sort of thing. But when we look at different kind of severity levels in depression, and most of the research is based on mild and moderate depression. So, in simplicity's sake, just kind of the people that have these depressive symptoms, but it's not significantly impacting their functional capabilities, that's where exercise may have a role. And even then, to the personalized point, just because someone has mild or moderate doesn't mean that they would want to exercise. But I think our job as a provider is to at least provide them with the education and the option and be able to help them do that if so that they are interested in taking that path.
100%. Absolutely. Giving that option. And
Mhm.
so what does that look like? And maybe you could reference the studies or what how you might have approached this in your practice.
Mhm.
When they've looked at exercise as something to prescribe, is that weight training? Is it taking a fitness class? Like what does that look like?
So, like we mentioned before, exercise is a very very broad term, right? So, how I like to simplify it is, if you were to prescribe a medication as a doctor, you're going to tell them the medication, you're going to tell them the route they take it, you're going to tell them the frequency, the dose. But as physicians, not to overgeneralize, but oftentimes when you're speaking to a patient, you tell them go exercise, you tell them go for a run. It's not really actionable. So, what we discussed in our paper, and this isn't a framework that we made, but a framework that we've adapted for our paper, it's called the FIT framework. So, it's FITT, and it breaks down exercise into a prescription, for lack of a better word, where F stands for frequency. So, how often you are setting that expectation of working out per week, let's say. I is the intensity. So that can be, a lower intensity, it can be moderate, or it can be a vigorous intensity. The T is the type of exercise. So that's what you were alluding to before with aerobic. So things like running, resistance would be something like weight training, or mind body is something like yoga. And of course, there's stuff in between that, but we keep it in kind of general terms. And then the timing